Good afternoon, and thank you all for being here on Tuesday afternoon. I hope everyone had a great Thanksgiving. I hope you did it outdoors. I hope you did it in very small groups, and I hope that you were especially careful and wore a mask. I want you to know that I am particularly grateful for everyone in our state for working to protect themselves, to protect their family, and to protect your neighbors. Our numbers here in Mississippi continue to rise, just as they continue to rise across the country. It's bad. It's bad everywhere, and it's certainly bad here in the great state of Mississippi. This is a dangerous time. We all need to adjust our behavior accordingly. As we've said to you before, we know what works. We know that wearing masks work. We know that wearing masks help prevent the transmission of the virus. We know that avoiding large social gatherings helps. Those are the core tools. We now know that we don't need to shut down schools, nor do we need to shut down small businesses, but we do all need to make small sacrifices. I've tried very hard throughout 2020 to be very measured, never working to cause panic or to cause false positivity. I think the most valuable resource I can try to safeguard is trust. We've never set long-term policies, and we've never done things on a whim. We've always been measured, and we've always tried to be careful. If people don't trust that I'm telling them the truth when it comes to this virus, they'll never listen when I say it's bad and getting worse. That's exactly the reason why, in spite of what you've heard from so many, that I have avoided hyperbole and I have avoided panic. It's why I hope that people will believe me today when I say this is a time when the virus is extremely present. It is all around us right now, more than almost any time before. And because of that, I have to continue to ask you to be careful. I have to continue to ask you to safeguard yourself. And I have to continue to ask you to do the little things to protect your loved ones. Based upon our objective criteria, today I have signed an executive order that will add 13 more counties for additional restrictive measures, bringing the total number of counties in our state up to 54. Many of the counties that we are adding are smaller counties, and therefore they have smaller absolute numbers, but they qualify based upon our objective criteria of more than 500 cases per 100,000 residents. The counties that we are adding today, in addition to the 41 that we had in effect last week, are as follows: Quitman County, Jefferson County, Franklin County, Noxubee, Kemper, Amite, Coahoma, Sunflower, Scott, Adams, Oktibbeha, Monroe, and Washington County. With respect to the vaccine, we continue to get positive news and positive developments. It is now looking like sometime by mid-December that we may receive our initial distribution, and obviously that is going to be a tremendous help in our efforts to fight this virus. It has been described as truly a light at the end of the tunnel. But what I'm saying to all of you as my fellow Mississippians here on the first day of December, we have to work hard to bridge the gap. To bridge the gap between now and not only when we start receiving vaccines, but when we can have an adequate number of our fellow Mississippians that have the ability to actually get the vaccines. We're obviously going to prioritize those first doses. And we also know that not only are we going to prioritize, we also know that for at least both the Pfizer and the Moderna vaccines. It's going to take not one, but 2 shots scheduled, I believe, Dr. Dobbs, something like at least 3 weeks apart. And so even if we were able to get shots in arms by December the 15th, those people would not be fully protected until sometime in early January. So what we are talking about today and these additional measures will help us hopefully bridge that gap and slow the spread of the virus, protect the integrity of our healthcare system, and allow us hopefully to get through 2020, and maybe 2021 will be better than this year. With that, I'm going to turn the mic over to Dr. Dobbs and let him give us an update. Thank you, Dr. Dobbs.
Yeah, thank you very much, Governor. Today we're reporting an additional 1,141 new cases. It's appalling that this seems like a low number, over 1,000 cases, and 29 additional deaths, sadly. If we look at our hospital utilization, we actually now have more COVID patients hospitalized than we have at any point in the pandemic, at well over 1,000 patients hospitalized. We do have a excess number within the general floors or the medical surgical beds. ICU capacity is stable. We continue to see ongoing rises in ICU utilization. I will say, though, when we look at hospitals that don't have ICU beds, currently we have 12 major hospitals in the state with 0 ICU beds, and we are starting to witness patients needing transfer care for specialized treatments that they are unable to obtain, at least in a timely manner, not only within the state of Mississippi, but also within the surrounding states. Again, something that should not be unexpected. If we look at community prevention, at the health department, we're getting an increasing number of calls from community members who are frustrated by the lack of enforcement or adherence to mask mandates or other measures. Would just like really to reinforce how important these are when it comes to following these guidelines as far as like the utility of masks, and certainly strongly appreciate the governor's support for this as a strong public health measure. Public health professionals, scientists are uniform that this is an important measure. It's kind of like if you had a heart attack and asked your crazy uncle to look up something on the internet instead of seeing a cardiologist. I mean, these are professionals who look at the data and understand that this is a useful thing. But masks alone are not adequate. What study after study has shown us is that masks don't work in situations when we don't wear masks. We don't wear masks when we eat, and we don't wear masks when we're around family, and we don't wear masks when we're in social gatherings. Right now is an important time, and strongly urge everyone to avoid any non-essential gathering. If there's no reason to go to a party, there's no reason right now. We're seeing large family gatherings or even small ones, or cocktail parties, or students getting together at a parent-sponsored social event. This is where we're seeing outbreaks. The other phenomenon that we're seeing is very concerning is we're seeing young asymptomatic children giving it to their parents and their grandparents. And this is a phenomenon that's very concerning after the Thanksgiving holiday, because we know that we have had a significant mixing of younger people who are higher risk for the infection, then transmitting it up to older folks who are at higher risk for adverse events, hospitalization, and death. And certainly we anticipate this will give us increased pressure and burden on the health system. If we look at vaccines, we're really excited to have some effective vaccines right around the corner. Both the Moderna and the Pfizer look to be 95% or so effective, at least based on the initial information that's released to us. The other part of this that's encouraging is the side effect profile. There have not really been much in the way of serious side effects. Now, there is a high likelihood of mild side effects, which is not totally unsurprising. We're seeing, if you look at the data so far, a significant proportion of people have pain at the injection site. Not very surprising. A significant minority will feel maybe a little bit sluggish or fatigued the following day. And even a smaller minority will have some measurable fever. But these are things that are not uncommon to vaccines. If we think about the pneumonia shot or the shingles vaccine, it's a reaction that's pretty similar, but these are transient and modest inconveniences when we consider the gravity and the seriousness of the coronavirus itself. But we look forward to having more information, and as CDC and other bodies and the Advisory Committee and Immunization Practice review these things, we'll have additional guidance for everyone in the very near future. Thank you, Governor.
Thank you, Dr. Dobbs. We have Director Michelle with us today. He and I visited George County yesterday to tour the damage from Hurricane Zeta. Hurricane Zeta was a significant storm. We anticipated that it would come ashore at a low level 2. It came ashore at almost a level 3 hurricane. And I think we have decided when all is said and done, Hurricane Zeta will be the most powerful, or at least the hurricane that has done the most damage in Mississippi since Hurricane Katrina here, and it occurred in November of this year. So it surprised us. It surprised many folks in South Mississippi, and it certainly surprised even the meteorologists, the strength to which it maintained throughout the state of Mississippi. It actually left the state of Mississippi up north of Greene County as a Category 2 hurricane. So again, very strong winds, significant damage, almost 1,000 homes in George County alone, and even more than that in Hancock and Harrison as well. So a lot of damage. Director Michelle and his team are doing great work, and I want to turn it over to him at this time.
Thank you, Governor. Good afternoon, everyone. Just to give you an update on a few things. First of all, we are in the process of closing out the Mississippi Emergency Relief Program. That was a CARES Act that went to counties and municipalities. We are, thus far, have paid out $67.5 million of the $69.5 million that was allocated for that program. We've got about $1 million remaining for those counties and municipalities that have been approved that will be paid out very soon. So we're very proud to report that we're going to have a near full allocation of that money and that funding out to those counties and municipalities that's participated. So I appreciate everyone's support across the state and leaders getting their projects in, and also for the team of folks who have been pushing that out. Just an update on PPE. We've talked before about with the uptick in our cases. Obviously, demand for PPE has increased a little bit. County pods out to the 82 counties and the Band of Choctaw Indians went out today, and still ongoing, and will be rolling out through the night and tomorrow. We've got scheduled approximately 30 Tier 1 deliveries that we'll be pushing out. So we're still keeping a very tight finger on the pulse there, and the men and women of the National Guard are doing a wonderful job continuing to get that out to our facilities. Update, just as the governor said, we did have a chance to be in George County yesterday, and just give you an update on where we are with that decoration process. We were, of course, one thing that's been a little bit confusing. We did get an emergency measures declaration for Hurricane Zeta. That was approved, and we had approximately 13 counties that were a part of that. And what that declaration, as far as for pre-landfall measures that we take to prepare for that, and we've done that consistently through this year for hurricanes that threaten the Mississippi Gulf Coast. That is different than the major declaration request that we submitted for the counties. It was submitted on November the 24th. That has been submitted, and by major declaration, I mean that is both for public assistance and individual assistance. The counties that were included in both IA and PA were Hancock, Harrison, Jackson, Stone, George, and Greene counties, and then we had 2 additional counties that were submitted for public assistance only. I want to reiterate that does not mean that other counties cannot be added should they meet their threshold, their damage thresholds. So we've submitted that. And just to reference back on the magnitude of Zeta, Zeta was a very damaging storm. The governor's absolutely correct. Based on our figures for the damages, that is the third most costly disaster that we've had in Mississippi since Hurricane Katrina. The storm came about. It did not decrease in strength, so it maintained a very high level Category 2 for quite some time as it moved across the state. So that being said, we had a lot of public utility damage with electricity, which also equated to a mass number of power outages. As always, our electric utility companies do a great job, but that drove the damages up significantly. And then we had an enormous amount of wind damage up in the the northern portion of the southeast section that was hit there. So we've submitted for that federal declaration, and now we're waiting for it to run through FEMA and get to the White House, and we hope to have a decision back on that. I'm hoping sometime either before or right after Christmas. Governor, that concludes my update, sir.
Thank you, Director Michelle, and thank you for everyone for being here today. At this time, I will open the floor to questions. Courtney Ann?
Governor, a couple of questions here. First, on the social gatherings, remind people about where we stand with what orders would be effective statewide as it relates to those numbers. I know that Dr. Dobbs has spoken a couple of times about not missing that point, especially in these county-by-county mandates. Remind people about where we stand statewide with that.
Yeah, so the most important thing I can say regarding the capacity limitations is none of these individual measures really are all that good by themselves. It's a combination of if we just simply wore a mask but yet gathered in this room with 300 people, there would be transmission that occurred because someone in the room would have it and there would be transmission occurred. And so it's each one of these taken together can slow the spread of the virus at the margins. You're not going to eliminate the spread of the virus, but can slow it considerably at the margins. And when we're talking about over time, 15% of everyone who gets the virus, roughly, becomes hospitalized. If you can reduce the total number of those who get it by 100, well, you just saved yourself 15 hospitalizations. If you can reduce over a week by 1,000, you just saved yourself 150 hospitalizations. And so, again, we're not going to completely eradicate it. That's never been our goal. It's about doing things together that, when taken together, can have a more significant impact. And so, what we're trying to do is not only encourage the wearing of masks, particularly indoors, but also reduce size limits. And so, for those individual counties where additional restrictions have been put in place, where there are 54 of them now, indoor gatherings for social events where there are not already other capacity limitations, it's limited to 10. And so that's something that is critically important, is if you can minimize the number of social gatherings that you attend, and you can minimize the number of social gatherings that you attend to only 10 per event, it can obviously make a huge difference. Dr. Dobbs and I have talked about this a lot. One of the challenges that we see, and we see it regularly, is a lot of people. I will tell you, I went to George County yesterday. George County is a wonderful county, voted 87% of the vote for President Trump, but they don't really like to be told what to do. But every single person at the event yesterday, which was outdoors, by the way, and heavily spaced, every single person in George County had on a mask. That makes a difference. And we've got to repeat that over and over and over at every single event. No one's going to be perfect. No one's going to bat 1,000. We know that. But we got to bat better than 300, which would make you an all-star in Major League Baseball. But we got to do a lot better than that. But what I'm telling you is, I do believe that the vast majority of our constituents, the vast majority of people in Mississippi, are trying to do right. But the challenge, and that's, by the way, in the counties that have the mask mandates and counties that don't, the vast majority of people are trying to do right. The challenge then becomes, even if you're trying to do right and you sit down and have lunch, say, at an office table with 7 or 8 or 9 or 10 even of your fellow workers. Again, you've worn a mask all day, whether you're on the factory floor or in an office. You've worn a mask all day. Well, when you sit down to eat, we can't really wear a mask in that scenario. And so we've seen, we've all had some personal experience with that having a significant impact. I look at some of the limited transmission that has occurred inside public schools and private schools. A lot of times, the kids are doing great, the teachers are doing great, wearing their mask, but then they all, at some point, have to eat lunch. Transmission occurs. And so, again, we all have to just be a little bit more knowledgeable and a little bit more focused on even going that one extra step, because the reality is the risk is higher of transmission today, and it's higher of you catching it, because the number of cases that we are reporting, there is more virus in the communities. Obviously, when there are 7,800 cases, which is what we saw last week. By the way, last week was actually a slight downtick compared to the week before, because we had very low numbers early in the week, but it was a holiday week, and some of the numbers that we've seen this week, which are significantly higher than what we saw last week, are a reason, a reflection of that. And so this week, it appears, at least the first 4 days, are much higher than last week, which was just a touch lower than the week before. But when you have 8,000 cases over a week, or 1,150 cases per day, there's much more virus in the community, and you're much more likely to catch it. than when you have 3,000 cases per week or some 350, 400, 450 per day. Yes, sir.
Thank you. Dr. Dobbs, this question is for you. We heard from Dr. Anthony Fauci over the weekend that some of the latest polls show only about 58% of Americans are real positive that they'll take, both the vaccines. He said in an interview that a lot of doctors and scientists will need to go out and gain the trust of the American people to get as much as possible to take it. For someone in your position, how would you speak to Mississippi to say that they need to trust their doctors, trust the Department of Health, that these vaccines will be the best option when they get here, and to, as a way of taking the virus real seriously, like you said a few minutes ago?
Yeah, so I don't think it's really a bad idea to be cautious, right? And so we haven't even seen the final data. We haven't seen the final FDA approvals or the CDC committee review. So I think there's, I'm not really worried about that level of caution. I wouldn't say that I would go out and get it immediately myself until we see the data. But I've been, obviously following it very closely, and with everything I've seen so far, I feel very confident and would anticipate that I would, be willing to get it myself. So I think putting our money where our mouth is, right? So I think the healthcare workers are going to be the first ones to get it. And so we need to make sure that we protect those who are on the front lines, but also protect those that are the most critical asset that's being overwhelmed right now. The flip side of this is I've also had a ton of calls about people begging for the vaccine. We've had a lot of demand. I think there's a lot of demand out there. It's easy to be concerned about, and they're going to be YouTube stories about so-and-so had a red arm, and then there's also going to be some false stories, and there'll be some false releases. And it wouldn't surprise me if there's some foreign actors who'll give us some false information. So please, trust your doctors. At the Department of Health, we'll try to be really trusted brokers of information and guidance, and we'll share data with you and have references if you need it. And right now, even with the side effect thing, if y'all need information, certainly there's data behind that, and we'll make sure that we do everything evidence-based.
And if I could, real quick, can you add to the side effects that you had mentioned earlier? Did you say, if I heard you correctly, there's no major side effects like nausea or things that come with other medicine? Is that right?
Yeah, there may have been a little bit of nausea. Mostly it's like if you get, a lot of vaccines, you'll have a little bit of maybe some achiness. A minority had some fever, injection site, pain and maybe a little inflammation, that sort of thing. But anything real serious, they haven't appreciated, anything that would be long-standing problems so far. Of course, this is only from the phase 2 data that we really have the details on, and hopefully the phase 3 data will look good. But all indications are that there are no serious long-term likely side effects. I mean, certainly anyone can be allergic to anything, right? But by and large, it looks really good.
Governor, I know that the last time we were here in this room that you answered a lot of questions about why not a statewide mask mandate, but I see that a few different hospitals and healthcare providers had sent a letter requesting that you issue one through the end of the year. Your response to them and saying that they believe that it is a part of a vital need to maintain the integrity of the healthcare system.
Yeah, I don't think I would respond to the letter per se, but what I would tell you is where I think there's general agreement between myself and those who want a mask mandate statewide is there is agreement that the more people wear a mask in public, the better off we are in terms of limiting transmission. The question then becomes, what policies can you put in place that allow for the most number of Mississippians to wear a mask the most amount of time? There are those who believe that if I'll just write on a piece of paper 3 words, statewide mask mandate, that all of a sudden there's 100% compliance and all is good. Now, there is enormous amount of data out there that just proves that that's not true. For instance, our friends to our west, I used a lot of data last week to refute that. But just for an example, our friends to the west in Louisiana have had a statewide mask mandate since June. Today they were reporting 5,327 cases. 5,327 cases. They're about 1.4 times our population, and they're reporting 5 times the number of cases that we're reporting today. So, it's like I almost feel like there are those out there who really truly believe that if I would write an executive order a statewide prohibition against hurricanes in 2021 that we won't have any hurricanes. It just doesn't work that way. And so what I believe is that if we go on a county-by-county basis, every time we add a county, I guarantee you, if you go and you look at my social media comments, you'll get a lot of people criticizing me today because some of them always do it. But if you go in every single instance, I promise you there's someone from Quitman County who is watching us today who says, okay, the governor just put Quitman County under this order. We really, it must be bad here. Because they know that I don't want to do it. I don't want to put anybody under additional restrictions. This is not this is not the reason I ran for governor, is so that I can enter executive orders and require things that I really don't even like at all. I guarantee that someone in Jefferson County and someone in Franklin County, Noxubee and Kemper, and Amite and Coahoma and Sunflower and Scott and Adams and Oktibbeha and Monroe and somebody in Washington County saw us today and said, when we added those 13 counties, obviously the virus numbers in their county justified the additional restrictions, and therefore I believe we will get more participation from people in those counties. Again, there is no disagreement between those who want us to do certain policies, and what we agree is the more people that wear a mask in public, the better we are as a state. That's true no matter what county you're in. That's true in all 82 counties. I just don't believe that if you put a policy like a mask mandate statewide in place and never replace it, that it has the same impact as if you add based upon the specific numbers. And I think there's state after state after state that have proven that. Now today, Mississippi has had the 33rd most coronavirus cases amongst all 50 states. Last week, we were 31st. A month ago, we were in the 27, 28 range. Back in August, we were in the 15, 16 range. And so what that tells you is, and we're still adding cases, by the way, and we're adding cases at a rate that's too high. But what that tells you is all these other states, 40 of which that have a statewide mask mandate, are actually seeing rises in cases that are far greater than ours. There are a lot of factors that go into it, but I do believe that the best way for us to get the most number of people to participate is by doing a county-by-county approach. Having said that, as the numbers continue to rise, as the number of counties that are under the mandate continue to rise, we may get to the point where all 82 counties should actually, the numbers justify mandate, and we may get to the point where there's such critical mass that we decide to do that. But I will tell you, if we were to do that, we'll do it for a short, limited period of time until things change, at which point we'll make a new decision. Every single day I wake up with the knowledge of the data that we had the day before. I view the data of the day. Every single Monday morning, Dr. Dobbs and his team, Dr. Byers, send me new data on what had occurred the 7 days prior, and that's how we make decisions. And I really believe that if we did a statewide mask mandate and left it in place for months and months and months on end, we would have less people in Mississippi wearing a mask than they're currently wearing it. I believe that, and I believe the data shows it.
Thank you, Governor. Still, I think it's important to look at the Department of Health charts. When we had the statewide mask mandate in place, we saw a very significant drop. The data show we went from in the 900s down to as low as 413 cases per day, and same with hospitalizations. And now we do these county by county mask mandates, yet we're at more hospitalizations than our peak now. So is it the data? Is it something we're not seeing in the data, or is it when you issue these mask mandates, local authorities just aren't enforcing them? Maybe.
No, I think if you look at the actual data and you look at the timing of the county by county approach that we started back in June, the rollover of overall number of cases actually started occurring before we put the statewide mask mandate in place. We put the statewide mask mandate in place at a period of time when the numbers were already declining, but that did help us. It helped us see a pretty significant decline because when I very reluctantly put the statewide mask mandate in place back several months ago, I believe it sent the message to people all across the state. It really, 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 really is bad, and it was. And so, one of the things that I will point out, where we find ourselves today compared to where we found ourselves at the peak in late July and early August. By the way, Mississippi is one of less than 10 states that can say that we are not at our all-time peak right now. We're close, but we're not there yet. And in fact, most states are significantly higher, in many instances 2 and 3 and 4 times the peak of where they found themselves at any time during the pandemic. One of the things, one of the advantages that we do not have today is the scenario under which, if all of the things that we've put in place that have made a difference, if we had done none of them, what would the curve look like? We can't measure ourselves against that sort of controlled environment, or either all the way one way or all the way the other. We just don't have the luxury of doing that. And so because of that, we have to look and see what has actually worked. I do believe that the county-by-county approach has worked. If you look at total hospitalizations today, while total confirmed patients with COVID is over 1,000 for the first time, that is true. I will tell you that I don't look at just that number by itself. I look at it by itself, but you've heard me say this a lot, I look at confirmed COVID patients plus suspected COVID patients. At our peak of hospitalizations, we had 1,250 combined today, because we do a better job of testing and we get our results back more quickly. The total number of suspected COVID cases in our hospitals is actually significantly less today than it was at our peak. We had about just shy of 1,000 total hospitalizations with confirmed COVID. We had almost 250 suspected cases at that time. Today we have approximately 100 suspected cases, and so our total hospitalizations are down relative to our peak, so we're not quite to that level yet. But the other interesting thing, which is a positive thing, is when you look at total patients in ICU beds, we're actually at 74% of where we were at our peak. We're at 250 today, whereas we had 337 patients in ICU beds confirmed with COVID at our peak. If you look at, we had over 200 patients on a ventilator at our peak. We're at about 70% of that with 142. So one of the things that tells us is, even though our total cases continue to rise, we're much better at treating the virus now, and that's a huge credit to our healthcare professionals, to Dr. Dobbs and his team. It's a huge credit to those at the hospitals. We're doing a better job of treating it, and so as I said, we need even better participation across the state. But I do believe that over the last couple of weeks, we have seen significantly better participation by folks across the board. We do have some challenge areas coming up. Obviously, as the weather gets colder and colder, people move inside and indoors. That does not bode well. It is likely that even if we could turn over our total number of cases compared to where we were last week and start seeing even a relatively slow decline, even if that were to occur the next several weeks, we would continue to see more hospitalizations. The more hospitalizations a day, this is something that we told you a week ago and we told you 2 weeks ago to suspect, because that is a lagging indicator. And so, again, this is the only way we're going to get control of the spread of the virus is for even more participation by more of our fellow Mississippians doing all of those things, not just wearing a mask, but minimizing crowd sizes, trying to stay outdoors rather than indoors, and trying to stay out of harm's way.
This is for Dr. Dobbs primarily. Mississippi is a small state with a relatively small medical family. Doctors, nurses, nurse practitioners. And yet, outside states that are much more financially endowed seem to be coming to our state and taking some of our personnel, offering them additional monies, bounties, as you will, bonuses to come and work there. Is this putting our state at risk, at a greater risk for health care for our residents?
Yeah, it's a real challenge, and it does undermine our health infrastructure without a doubt. Wealthy health systems in Florida and Texas and big places like that, you know, they're sitting on cash they can use to steal our folks. So, but fortunately, most folks, most nurses, most people stay here and work. The nurses, I think, are the most vulnerable because there's a well-established sort of travel nurse sort of industry out there. The acuity of it doesn't seem to be quite as extreme as it was over the summer. That seemed to be a lot worse, but we know it's a challenge. I would just like to make a plea for, if you're a nurse in Mississippi, if you're a respiratory therapist, stay home, take care of your family, take care of your community. They're going to be here when you're done. You're a hero if you stay and turn away a quick buck to take care of the people you love. So let's stay here together and take care of our communities.
I'll just point out that is one of the challenges that we find ourselves in going into the colder, more winter months. You know, again, if you look at our cases relative to so many other states, while we're rising way too rapidly, we're rising less rapidly than most other states. Unlike the March and April significant increase, which occurred mostly in the Northeast, and unlike the summer increase, which happened mostly in the Sun Belt, this is a nationwide occurrence. And therefore, where we could, you know, some would use the term steal, I'll use the term borrow nurses maybe from other parts of the country to go to where the hot spots are. If you look right now, the hot spot is most states are seeing spots that are a heck of a lot more hot than they were at any time over the last 8 to 9 months. Yes, ma'am.
Nick Juden with Jackson Free Press has a question.
Great.
Hi, thank you. Governor, I've spoken to a lot of doctors and a lot of public health officials who are desperate for help today. And I want to point out that when we talk about where we are right now, when we talk about these numbers, that's pre-Thanksgiving. It's the largest gatherings we've seen in the pandemic so far. So we're at our peak, we're exceeding it, and we're at a worse place for hospitalizations overall in Mississippi as well as the rest of the country. On the other hand,
Buy-in from local elected officials. And what I will tell you is, by and large, there are always going to be outliers, but by and large, we've seen significant response by our mayors, by our members of the Board of Supervisors, and I'm very proud of so many of them for doing that. What I will tell you is that masks do in fact work, and that is something that I think is very important, and I think it's something that we've got to continue to stress to our constituents, that if we'll do the little things, we can make a huge difference.
Jack with Clarion Ledger has a question.
Great.
Hey, Governor Reeves. Back in July, you slammed the media for supposedly ignoring the coronavirus pandemic. You blamed a surge of new cases on news outlets without citing any evidence of your theory. Now cases are again surging, and while journalists throughout Mississippi continue to diligently cover a third wave of new cases here, you're holding fewer press conferences now than you had been at other points in the pandemic, even as the state appears headed for a dark and ugly winter. So I think it's time for me to ask, why aren't you holding more press conferences and doing more to warn Mississippians?
Well, thank you, Jack. I appreciate the question, and I appreciate the time that you've spent in Mississippi. I think you've done a good job as a journalist trying to focus your efforts on journalism and not on advocacy. And so I want to congratulate you for that, and I wish you the best of luck in your future endeavors. Honestly, the reason that we've had fewer press conferences over the last 3 weeks is because my lead advisor and good friend, Dr. Dobbs, told me when my daughter tested positive that I had to stay isolated for 14 days. And obviously, isolation over a 2-week period does not lend itself significantly to a lot of press conferences. But it is something that I think is important. I think it's important that we continue to communicate with the people of our state. We obviously did it last Tuesday before Thanksgiving. We're doing it this Tuesday. After Thanksgiving, we are adding additional counties. And so I think it's fair to say a lot of the journalists that are on this call have been covering politics and politicians in Mississippi for a long, long time. I don't know that any politician has made themselves available to hours and hours and hours and hours and hours of questions to the extent that I have over the last year. and I hope to continue that. And I think it's important. I think it's important that we continue to convey the facts to the people of our state, and that's why I think it's so important that we do so in a way where we do, in fact, talk about the facts and the actual numbers and the data, because I happen to believe and I trust that the people of Mississippi, if you give them the facts, they'll make the right decisions. Yes, sir.
Thank you, Governor. I'd like to ask something about high school and youth sports. I know your daughters, by the way. I hope your youngest one is doing better.
Thank you.
I know your oldest and your second oldest, I believe, do several sports. Now, we have been seeing, especially in high school football playoffs, people are outdoors, but they're standing shoulder to shoulder, coughing or yelling, hugging, and that can still, we know, be a spreader, even if you're outdoors, especially when we see not a lot of people in the stands wearing masks. So in your conversations with Dr. Dobbs, do you believe that a lot of rises in high school sports, especially when we go to basketball season indoors, is contributing to the spikes we're seeing today, people not following the guidelines?
We certainly have a lot of conversations surrounding that, and we think it's a situation that we have to continue to monitor. I will tell you that as someone who played youth sports, as someone who has young daughters that are playing youth sports, both in the high school setting and outside, one of the things that I have often said from this podium, maybe not often enough if you listen to Jack, but the nearly daily, certainly weekly press conferences that we do, is that one of the things that I'm very worried about is the mental health of young people across this state and across this nation. The lack of normalcy, the lack of sports, the lack of opportunities to do things has been tough from a mental aspect. And so we have to weigh the challenges that exist with respect to this virus. We have to weigh that with the potential additional risk of particularly indoor sporting events. And that's a scenario that we're going to continue to monitor very, very closely. And should it become necessary to change our current guidelines, we will do so. But I will tell you that I believe that if we can keep participation to smaller numbers and individuals, and particularly those that are going to ball games, if they will stay in their nuclear family units, in other words, if mom and dad and one sibling or two siblings go to a ball game, if they'll sit by each other but not gather up, that'll make a huge difference. Because I think, and Dr. Dobbs may want to speak to this, we see some, but I think it's fair to say that there seems to be less transmission in the classroom setting where there is real structure than there is in the outdoor event, not necessarily outdoor, but outside the classroom events, even within our schools, whether it's sporting events or band competitions or dance competitions, etc. And so, yes, there is a real issue there. I will tell you, I am absolutely committed to doing everything I can to make sure that as many Mississippi kids as possible are in the classroom learning. And I am willing to make the decision to reduce sporting events, and I am willing to make the decision, should it become necessary, to reduce extracurricular activities to ensure that our kids can stay in the classroom. Staying in the classroom is priority number one for our kids, for me. But I also want to point out that is a decision that I do not want to make, mainly because I understand that there are ramifications and there are risks associated with not having those events as well. And so, again, here we find ourselves the first day of December. We have less than 3 weeks left in this semester. And so if we all, as a state, and all of our citizens will double down on our efforts to do the little things, whether it be at sporting events, in the classroom, or social gatherings, I think if we'll do those things, we have a chance to get through the next 3 weeks of school. Then we have 2 weeks of Christmas vacation at least. And then by the time we start back school sometime in January, hopefully we will have begun the process of vaccinations, which will go a long way towards helping us curb the risk even further. Again, the vaccinations by themselves don't eliminate risk of the transmission of the virus. It is another tool in the toolbox, in addition to masks, in addition to smaller gatherings, in addition to all the things that we're doing that can make a difference.
Right. It's easy for us to agree that kids should be active and can play some sports, and of course they should be in the classroom, but we got a little bit off track. My question was really centered around fans in the stands and parents in the stands. When we see the high school football playoffs, when we see people in the basketball stands, they're all shoulder to shoulder. Jackson Academy, I mean, you may have not saw the video, but when we see highlights, was some of the worst. So my question is, are there guidelines right now prohibiting limited capacity at high school games, and just again, is it the fans and the parents just gathering shoulder to shoulder contributing to the spikes more now?
Well, there's no doubt that fans that are gathering shoulder to shoulder in full gymnasiums or other settings is not the ideal scenario. We do have capacity limitations in place. We've had tighter restrictions. If you'll recall, when we started high school football in August, we actually limited those stadiums to 2 per participant.
Are any of those still in place?
There are some that are still in place, not the 2 per. Obviously, as the numbers came down in late August, we were able to expand that, but we are certainly monitoring and looking at should it make sense to put tighter restrictions on.
Thanks, Bailey. This is a question for Dr. Dobbs. You mentioned that 12 major hospitals in the state are out of ICU beds right now. Can you give us an idea of what that means? How many beds are available at this point in the state? And if you know, what percentage of total ICU beds are full in Mississippi?
Yeah, and I'm sorry I don't have that number in front of me. As far as like the percentage, but certainly we can get that for you pretty easily. What it means is we don't have the flexibility to move folks around. And I got a call this morning about a patient who had COVID and was critically ill and needed to go to a major hospital, and they couldn't go. There was nowhere to go. There was nowhere in Mississippi and nowhere in Louisiana. And so what's going to happen, it's not going to just be coronavirus. It's going to be someone has a heart attack or someone has a stroke or someone has a car wreck, and we're going to call up and there's no room in the inn, right? What's going to happen is I think people will get care in the ERs, but it's going to back up the ERs. And people are just not going to have access to care. The hospitals are doing a great job right now. They're managing well. They're balancing things out. If we look at our total ICU capacity, it's stable as it has been over the past couple of weeks. But we know that when coronavirus, and this is something that's very unique to COVID patients compared to the average ICU patient, is they stay in the hospital a lot longer. So if you get a COVID patient, you put in the ICU, you don't have that flexibility. It's kind of, you don't have that liquidity of patient flow that you have when you have other, more temporary sort of medical conditions. So it's going to basically continue to gum up the works. But right now, ICU capacity overall has some flexibility within hospitals, but we're going to see spot shortages. And if we look at the rise in hospitalizations, and what will happen is people get hospitalized and they stay on the floor, and if they get worse, they go to the ICU. The other thing that really worries me over the Thanksgiving holiday is going to be that we had all these gatherings, and these kids who are contagious are going to get, I can't tell you how many times I've had 3 times this week. I've had a young adult or middle-aged adult say, I have coronavirus, but I'm very careful. I don't know where they have it. I got it. And I said, do you have a kid? And they said, yeah. And say, what school they go to? And I said, they have it. And every time they checked the kid had it, even though they didn't have any symptoms. So that's the sort of situation we're looking at going into this post-Thanksgiving situation. So I'm hoping that a lot of people are safe. I know a lot of older folks were cautious, and I think that's very important. It's a lesson we need to take with us into Christmas. If you're making your...
There's been quite a storm surge with destruction of some harbors and things as such. The question I have for you, Director Michelle, is the cities, the municipalities, if they come up with assessments and reached out to you guys, especially like in a Long Beach or Pass Christian, where Long Beach, the harbor was totally destroyed and Pass Christian was very severely damaged. Just as far as that goes, where is it going from here now?
Yep, so I appreciate that, Hunter. Good question. We actually, and the governor was with me, we actually went down and visited, I believe it was Long Beach Harbor or Pass Christian, but we visited, looked at those harbors, and you're right, they did take some significant damage and had a lot of damage their area, and a lot of it was on the highway down there. But so the process, the way that that's going to go is once this declaration is made, and I'm very confident we're at 79 million and climbing in damage that falls into the public assistance category. So I'm very confident that we will be awarded a public assistance declaration at some point. Once that happens, then those counties and municipalities will then begin to submit projects. In those cases with those harbors, they'll submit project work statements that they will be submitted through FEMA's portal. We'll monitor those, and then they will begin to get reimbursements for those projects. But yeah, there was some significant damage there. We did get to actually see those firsthand.
I'll just reiterate that we did visit the Long Beach Harbor back just a day, I believe, after the storm, and there was significant damage to the harbor, and there's a lot of damage throughout the state. The storm surge of Zeta was significant and did a lot of damage, and that's where a lot of that $80 million comes from. A lot of public access areas got hit pretty hard. Bailey?
Kobe Vance with MPB has a question.
Hey, Governor. You mentioned earlier whenever Nick June called this the peak of the pandemic, you called it unequivocally false. But right now, Mississippi's 7-day rolling average is topping 1,400 cases, which is our highest so far, and our hospitalizations are at their highest point as well. If that's not a definition of a peak of a pandemic, what is some of the benchmarks we should be looking for to see where we are as far as in relations to the peak?
Well, obviously, we look at a lot of data, and there's no question that where we find ourselves today is in a position that is far greater than where we want to be. And it's much worse, as I said in my opening remarks, than what I would like for it to be, and certainly what anyone would like for it to be. But when you look at the data and you look at total number of folks with COVID that are confirmed and are suspected, we're currently at about 1,158 total hospitalizations, whereas at our peak we reached 1,250. If you look at total number of patients in an ICU bed, today we're at 250. At our peak we were at 337. If you look at total patients that are on a ventilator, we exceeded 200 at the peak. Today we're at 142. Now, having said that, we also know that hospitalizations are a lagging indicator, and therefore it is likely, if the caseload stays where it was 2 weeks ago, which was 8,200 cases over a 7-day period. And again, as I have done repeatedly, we try to be consistent in looking at week numbers starting on Saturday, ending on Friday, because that is the way Dr. Birx and the Coronavirus Task Force send us the White House data. We had 8,200 cases 2 weeks ago. We had 7,800 cases approximately on the day that ended on Friday. We also know that last week was a holiday week, and so many of the cases that we are reporting on Sunday, Monday, and Tuesday of this week actually come from last week. So all of that is to say that we are in a position today, regardless of whether or not we can argue about peak versus not peak. Here's the reality. It's bad in Mississippi. It's bad in virtually every other state around America, and Mississippi is no exception. And so rather than trying to pick fights about you look at this data point, I look at that data point, why don't we all focus on spreading the gospel of doing what is most important going forward, which is wearing a mask, staying socially distanced, staying more than 6 feet apart, washing your hands regularly. I will tell you, I don't think mask shaming on either side works. I don't think if you wear a mask and you shame someone who doesn't, I don't think that's going to work very well. I think if you don't wear a mask and you shame someone because they do, I don't think that's going to work very well. Let's all take a step back. Let's recognize the challenges that we face and try to do the little things to make a difference going forward. I can't change what happened a week ago or a year ago, but I can affect what's going to happen tomorrow. If every one of us as Mississippians will take that approach, I think it'll go a long way towards helping us. Okay, so I've been here an hour today, and we'll come back, I'm sure, at some point soon. But I want to, again, thank all of you for being here, for your efforts to get information out to our fellow Mississippians and working together. I know that we'll get through this very challenging time. Thank you all. Have a great day.